All right, good afternoon. We have a couple in here today, and hopefully some people can join online. I'm going to wait a couple minutes to see if anybody else comes in. So this lesson is going to be on therapy and also biomedical treatment. So if you have those notes, I'd like you to go ahead and get those out. All right, I'm going to go ahead and get started. All right, thanks for those who are able to make it today. All right, so first term we looked at is psychotherapy. So that's an interaction between a therapist and a patient. So it's that therapy session conducted by a psychologist or psychiatrist. Electric approach. And we're going to look at 5 different types of psychotherapy. An electric approach is using a variety of techniques. Let me get rid of that email. It keeps making that noise. Okay, so electric approach means that you're going to use a variety of approaches or therapy. So a lot of times in a therapy session, it's just going to be trial and error. So you are trying many different types of therapy. You might try behavior therapy. It doesn't work, so you might try cognitive therapy. You may try medication, some type of biomedical technique. So a lot of times, since we're all different and we all experience mental illness very different, the treatment's going to depend on the particular individual and their specific symptoms. So it's up to the therapist to just find which one that works best for their client. All right, so the first type of therapy we looked at is free association, and you know this well by now. This perspective or this type of therapy was created by Sigmund Freud. According to this perspective, we act the way we do because of some unconscious thought that we're completely unaware of, or it could be some childhood experience that we had. Okay, so an unconscious thought, and I gave you the example in class, this could be, let's say there's a boy in elementary school and he starts being really mean to his best friend. And when he's asked, why are you doing this? He's like, I don't know. I just don't like him anymore. So a psychoanalyst during psychotherapy would use free association to figure out what's going unconsciously or subconsciously that's driving this behavior. So for free association, they have people sit down and say whatever comes to their mind, no matter how embarrassing it is. So the therapist then writes down all of their responses, everything that they say, and then they analyze them, try to figure out what's unconsciously driving their behavior. So they might find that through free association, the child starts revealing that his best friend has all of these new things. So the underlying cause of his anger could be possibly jealousy. Right. So it's very subjective, very critical. The therapist comes to the conclusion of what's unconsciously causing you to act different or irrational. If you've ever seen a movie with a psychiatrist, you've probably seen free association. All right, so the second type of therapy comes from the humanistic perspective. Remember, from a humanistic perspective, they would say that we act the way we do I think the way we do because of our self-esteem, how we feel about ourselves. So if we are aware and we like ourselves, we have good self-awareness, we accept ourselves, we have high self-esteem, we're going to act more independent. We will be more confident. In general, we'll just be more social and interactive and more productive. If we don't like ourselves, we're going to be more introverted. We're not going to be very confident. We're not going to try new things. So that can influence our behavior. So the goal here is to try and improve self-awareness and self-acceptance. All right, so we know that the two humanists by now, that would be, yes, Maslow and Rogers. So Abraham Maslow and Carl Rogers are the two we associate with humanism. Rogers came up with client-centered therapy. So this is a type of therapy where you just sit and listen. The client or the patient is the focus. You just sit and you let them talk, kind of like free association, but you're not judgmental whatsoever. You're not critical. You're not trying to tell them what's going on. You're not worried about unconscious thoughts, hidden thoughts, childhood experiences. So what they are doing involves what they call active listening. So you just sit and you actively listen to what they say. And you never really analyze them or judge them or give them any suggestion on what to do or what's causing their behavior or how to change. You just simply rephrase what they are saying and echo it back to them. So if somebody's going on and on about, I don't know, their roommate or their teacher, you would just say, okay, so what I'm hearing is you're frustrated. Your teacher or your friend, you're having difficulty with them. You just echo it back. You just restate it. And that's supposed to make them self-aware, okay, aware of the issue, and then able to work through it on their own. So very non-judgmental. All right, so that brings us to behavior therapy. So behavior therapy, they're not worried about unconscious thoughts, or childhood experiences like psychoanalysis. They're not worried about self-awareness or self-esteem. It's simply your behavior is irrational and it needs to change. So behavior therapy involves counter conditioning, trying to teach you new ways to behave, to replace that irrational behavior. And there are several different types. First of all, exposure therapy. This is most likely used for phobias. So whatever you are afraid of and you have this irrational fear of, you're just exposed to it. And they believe exposing you to that over and over and over again, the anxiety will go away. You'll just get used to it. So in therapy sessions, if someone's afraid of heights, they may take them out and they may go on top of a building and look down, or up in a glass elevator and look down. And eventually you will get used to that and be able to accept or adjust to heights. Or if you are afraid of dogs, they might bring a dog into a session over and over again until you get comfortable. You, at one time, you either had to bring things in or you had to go out of the office in order to do exposure therapy. But now they have glasses, they're goggles that you can do virtual reality. You can, it's like a simulator. You can put them on. It feels like you're up, up on a tall building or up on a glass elevator, or you're being exposed to whatever it is that you fear. So exposure therapy. A type of exposure therapy is systematic desensitization. So again, exposing over and over again will desensitize you and reduce the anxiety and allow you to accept that whatever you're afraid of, that irrational fear. But here you want to do it in a relaxing environment. So you may play soft music to relax the client. You may, if it's a child, give them their favorite blankie or a stuffed animal, just somehow to relax them. And you want to do it in small steps. For example, if somebody's afraid of a spider, on the first therapy session, you don't want to bring in a spider and make them hold it. You would start off showing them a picture, and then maybe a toy spider, and then a dead spider. You work your way up in small steps. All right, aversive means unpleasant. So the third type of counter conditioning, these all fall under behaviorist therapy. This is trying to do something unpleasant to someone to get them to stop doing something. So the example they have in the book here is someone's an alcoholic. So they add a medication that makes the person feel nauseous. They add it to their alcohol. So they start to associate the alcohol with that nauseated feeling. And the thought is then they will stop using alcohol because they made that connection. Parents may use this sometimes on their young children. Let's say your young child sucks on a pacifier and they're getting to the age where they need to go to preschool and they need to stop using it. But kids do not want to give that up. So you may dip that into something that they don't like. And every time they put the pacifier in, they taste that. So then they start to associate the two and they stop using it, like mustard or something that they dislike. So aversive is unpleasant. Token economy, I don't have anything written down here, but we've talked about that a couple times. A token economy is a type of behavior modification where you're trying to train people to act appropriate by giving them tokens or check marks that they can accumulate and turn in for a prize. Like the treasure box in kindergarten. You know, if you're good and you get a check mark Monday, Tuesday, Wednesday, Thursday, on Friday, you can pick a toy out of the treasure box. And we use those at the Finance Center when I was a nurse there. Most patients had a behavior contract. And if they did not engage in that negative behavior throughout the day, they got a check mark. And then they got extra like visiting hours or, you know, extra food or whatever was important to them. Token economy. All right, the fourth type of therapy is called cognitive therapy. Cognitive therapists are not worried about unconscious thoughts. They're not worried about childhood experiences, self-awareness, self-esteem. They're not worried about the specific behavior. To them, from this perspective, your thoughts are driving your behavior. They're causing you to act the way you do. So, for example, you walk into a situation and your thoughts about what's going on will cause your behavior. So the thought here is the thought. If you can change someone's way of thinking, it will ultimately change their behavior. And Aaron Beck was the person who came up with this. Cognitive behavior therapy is a fifth type I don't have here that's often used together as an eclectic approach. So they're focused on educational therapy, trying to teach you new ways to act or think. And ultimately, that will affect your behavior. So that's a very popular form of treatment. I'm going to shut my window. I'm getting cold. Okay, so those are the different types of psychotherapy. A few other types of therapy that are usually not conducted by a psychologist, but rather a counselor, which you need a master's degree for. Okay, a family therapy. This is obviously a type of therapy setting where you're dealing with families who are having issues, maybe communicating or I don't know, someone did something in the family and others are having difficulty coping. So the therapist just kind of listens to them and provides strategy on how to solve the family issue. Group therapies, this would be like Alcoholics Anonymous. And again, the therapist would just listen to the participants talk about their experience. It's really beneficial sometimes to hear that other people share your particular struggle. It makes you better able to cope with the fact that you have something wrong. And a lot of times people will share their strategies that may work for them. So then other people may benefit from that. But the therapist just kind of leads with some suggestion, and they get to listen to each other and try and help each other. This is all review. So you have two different types of psychologists that actually treat patients or clients. First of all, clinical. Okay, these are people who have their doctorate in psychology, and you can pick specialization. You can pick child, adolescent, or just adult, or just fall under clinical and treat all ages. Clinical psychologists, they can have their own practice. They can be found in hospitals. They can be found in mental institutions, but they treat the more severe problems, the more emotional or the more severe mental illness. Counselors, again, you only have to have your master's to be a counselor. Counselor, they can be found in their own private practice as well. Schools, hospitals, again, clinics or health departments. You can find them, mental institutions. But a counselor specifically deals with everyday problems that many of us will face. It could be like divorce or loss of a loved one or an eating disorder. If you're in school, dealing with bullying. So these are things that many of us will face. All right, so that brings us to biomedical treatment. So these are any types of treatments that deal with the nervous system. All right, let's start off with drug therapies, psychopharmacology. So psychopharmacology is the use of drugs to treat an individual with mental illness, and there are a few categories you need to know. First of all, your antipsychotic drugs. These treat schizophrenia. Okay, so what's going on? Someone with schizophrenia has an excess of dopamine going through their body. That's the most likely, most common type of schizophrenia, paranoid schizophrenia. So that leads to hallucinations and delusions because of that increase in dopamine. Fortunately, we can treat that with an antipsychotic medication such as Haldol or Thorazine. Clozapine would be another. That actually brings the dopamine levels back down to normal, and the hallucinations and delusions go away. Bad thing is they make you feel sluggish, both mentally and physically. So a lot of people don't like to take them. So they often stop taking them, and then the hallucinations and delusions come back, and they end up back in the hospital to be restabilized on medication. There's also side effects of uncontrollable muscle movements with antipsychotic drugs called tardive dyskinesia. Also with the anxiety drugs. Anti-anxiety, they treat your anxiety disorders. So generalized anxiety disorders, panic attack, PTSD, OCD. Two common ones are Xanax and Ativan. Antidepressants, a lot of people who suffer from major depressive disorder have low levels of the neurotransmitter serotonin. So they take antipsychotic drugs such as Paxil, Prozac, or Zoloft, and that increases the level of serotonin in the body and makes you feel better. It increases your mood. A mood stabilizer, this would be used to treat bipolar disorder. That is when people have the extreme lows of depression coupled with the mania, that super high energy and flight of ideas. They go through periods of that as well. Used to be called manic depressive. So a mood stabilizer such as lithium will keep the serotonin and epinephrine levels even to prevent them from going up and down. All right, the second biomedical treatment would be brain stimulation, specifically electroconvulsive therapy. So this is sending electric shock through an individual. The thought was that your thoughts that travel through your body, your neural impulses are electric. So if you can electrically stimulate someone, that could just possibly rewire the circuitry in the brain and stop people from acting irrational. It's like a crapshoot, I guess. For some people it worked, for others it doesn't. But it was very common before we had medication available to treat mental illness. Still used today for severely depressed patients. Psychosurgery. This is like the lobotomy. It's damage to lesioning some part of the brain. So Edgar Monet came up with the first lobotomy, but it was pretty invasive. You had to drill holes in the side of the temples, and then you took like a scalpel in on both sides and went up and down like a windshield washer motion. And of course, it's be different every time you do it. But they wanted to disconnect the neural connections between the frontal lobe and the limbic system, because the limbic system is your impulsive area. And they use this a lot on people who are overly aggressive. If you can contain those impulses into the limbic system and not allow them to go to the frontal lobe, you won't act upon them. So yeah, it worked for some. It became very common practice here in the United States. People were lobotomized for many reasons. And it just to tell you how common it was, Senator Kennedy, so JFK's dad, Joseph Kennedy, his daughter, Rosemary, when she became a teenager, was a little bit over-aggressive and with boys, and it was kind of an embarrassment for the family. So they took her to a person who did lobotomies, and they lobotomized her, and she lived in an institution the rest of her life. A lot of people who have a lobotomy done, they can still function. She couldn't, but a lot of people can still function, but they lose their character. They lose their personality. They're just kind of like a drone. But some people it really affects, and they lose cognitive and physical ability as a result of that. Again, after medications became available, they stopped using the lobotomy, but it did improve. Walter Freeman came up with what's called the transorbital lobotomy, where they used an ice pick. You had to break the bones of the eye socket with a little mallet, and then you'd put this little ice pick in that had a hook on it and do the motion up and down, which would have the same effect as the original one that Monet came up with. You think back, how could people do all of these awful treatments such as electric shock or lobotomies? But before we had medication and different types of therapy available for mental illness, it was pretty much all they knew. And it's hard to judge that, because if you go back and put yourself in their place, if you had a loved one who is suffering from a mental illness, or you were yourself, and you know something that helped someone, you're often willing to try anything. You compare it to chemotherapy today. Chemotherapy is a very painful process for people to go through, but it's really one of the only methods we know available for treating cancer once someone develops it. And, I don't know, 20 years from now, they may look back and have a treatment and say, well, how could they administer chemotherapy to their loved ones? That's so barbaric. But when it's all it's just hard to judge people from the past. So, okay, so I'm going to stop there. If I always recommend that you look over questions from your review book, and I'll be here for another half hour. Let me know if you have any questions about any of the information you come across in your practice book. All right, I hope you have a really good evening, and I will see you all tomorrow.